Now let's apply the concepts of high-value, cost-conscious care to our second case, pneumonia in a 2-year-old. So the patient presents with a chief complaint of fever in a 2-year-old child. You're working in the emergency center, evaluating a 2-year-old male presenting with a 1-day history of fever. Per mom, he's been slightly fussy since last night, not eating as well as usual. He's had a runny nose and some congestion for the last 3 days, with 1 day of productive cough and post-test of emesis. Today, he was febrile to 101.2. So mom rushed him to the doctor's office, where the pediatrician felt he was too sick for the office, so he was sent to the Texas Children's Emergency Center. Past medical history, family history, and social history are all non-contributory. On physical exams, he has a temperature of 101.2, a heart rate of 130, a respiratory rate of 42, and a blood pressure of 92/68. His growth parameters are normal, and he has an oxygen saturation of 92% on room air. He has some dried mucus in the nares, but otherwise his HENT exam is normal. His neck is supple. On respiratory exam, you notice coarse, transmitted upper airway sounds throughout, with slightly coarse breath sounds in the left lower lobe area as well as crackles in that area. There's no wheezing and no significant increased work of breathing. He has a CRS of about 3. On cardiac exam, his heart is regular rate and rhythm. No murmur is heard, and he has good pulses. His abdomen is soft, non-distended, with good bowel sounds and no masses or hepatosplenomegaly appreciated. He fusses a bit with deep palpation diffusely, but there's minimal guarding and no rebound tenderness. He's slightly fussy without any focal neurologic deficits. He fixes and follows in all directions and has good tone and deep tendon reflexes. His skin is hot, dry, and pink with a good cap refill. And on his extremities, there's no clubbing or cyanosis, and he has full range of motion. His back, GU, lymphatic exams are all non-contributory. You consider ordering a chest x-ray, some blood testing, and viral studies. The mother, who was mildly anxious before, now looks very worried. She asks if you have to admit him and do all of those tests, as she's worried it will cost a lot of money. She then starts to cry, explaining that her employer no longer offers health insurance through the company, but rather provides the employees with a stipend which can be used to purchase insurance on the state-run insurance exchanges. She purchased the only plan she could afford, a bronze level plan with a high deductible born out of the Affordable Care Act. So she's fearful she will have a very high bill up front that she cannot afford to pay. You try to console the mom. During your discussion, you A. Reassure mom that the hospital is nonprofit and has a foundation that helps cover excessive costs through charity. B. Reassure mom that all of the tests are in the best interest of her son, which outweighs any of the costs. C. Engage in a discussion with mom before proceeding to determine which tests are absolutely necessary. Then offer to call social work and the financial counselor to provide her with more detailed cost information. D. Direct mom toward online cost estimators and her insurance company, which might be able to assist her.